So welcome everyone to the CFHI Academic Partners Summit. This is our inaugural summit in 2024, and we're so excited to have you here. Our goal is to create a gathering space around the shared commitments we all have. Just to highlight kind of what CFHI's stance is in terms of our work, we have a three-part mission, which includes research, thought leadership, and programs. And we are committed to emphasizing local community leadership of global health educational experiences, global citizenship, and ethical engagement. So in the next 90 minutes, we're going to dive deeper into how that's done and how we interact and intersect between universities, local partners, and facilitating organizations. We have some of our global team here with us today, so excited to welcome them to these conversations. But I want to mention that we are representing a huge swath of folks who have committed their life and are passionate about impacting the global perspective of trainees, faculty, and the entire global health sector. So for the CFHI global team, could you, if you're a global team member, say hi in the chat and mention where you're from, just so our academic partners can see who's joining us in real time. We're so excited to represent our wider team as well. So some goals for our time together. Number one is really building the community of practice and creating a gathering space for exploration that we're all taking, whether we're in universities or at the community level, around how do we teach and nurture global health competencies and health equity throughout the learner's journey. The second is to highlight curricular elements and to further align the work that CFHI is doing with your students and trainees with that's happening on campus in pre-departure training and other ways. So our goal is to have coherence between what is happening on campus, in classrooms, in pre-departure contexts, and then in communities globally. So today is really an opportunity to highlight those curricular elements and navigate the collaboration that we all hope for. And then we're going to further explore the programmatic structures, our quality improvement processes, and advances in student support and safety. Safety and wellness is really foundational to academic success, as we all know, and is increasingly in focus. So excited to talk about how we're all doing that. But first, we need to be inspired, and Dr. Matt Daxo is here today from University of Texas, San Antonio, where he is a director of the Charles E. Cheever Jr. Center for Medical Humanities and Ethics. So excited to have our friend and colleague here, and I'll turn it over to Dr. Daxo.
All right. Thank you, Dr. Ebert. Thanks, Jess. Appreciate it. And thanks to everybody for being here. Some folks here I know, some folks I don't know. So I appreciate seeing all of the introductions in the chat. Please keep those coming. It's really great to see folks introduce themselves, and I'm sure that's going to come to be relevant during the day. So when Dr. Jessica Ebert asks you to deliver inspiration, then you take some time and you reflect and you try to figure out what is going to inspire people. So go ahead, Jess. So as we're talking, I think it's really important as this day goes on and as this group starts to connect with one another, you just sort of level setting on why is this work important right now, at this moment in time, at this moment in our shared history. Why is global health important right now? So I think it'll be great to start seeing those responses flow in the chat. You can go ahead. So whenever you deliver a little bit of inspiration, I think we have to start with a little bit of reality. And unfortunately, reality is at times inspiring and at times not so inspiring. So we're going to start with a little bit of some of the challenges that I think are bringing all of us together at this moment, with a quote from Dr. Paul Farmer, which says, if you want to change the world, you need to be grounded in reality. You can go ahead. So we are in this era of very wicked problems. We're seeing climate change, certainly here in the South. I'm in Texas, but our neighbors in Florida are experiencing some of the effects of climate change with unprecedented numbers of storms and severity of storms. But worldwide, it's affecting people's lives and livelihoods. We're seeing unprecedented amounts of global conflict. In conflict and war zones, these are things that I think are existential crises for global health practitioners like ourselves. This is driving both climate change and conflict are significant drivers of human migration, another large wicked problem. And then finally, we're seeing because of movement of peoples, animals, and the shared environment, we're seeing the emergence of novel pathogens that I think are challenging our health systems worldwide. You can go ahead, Jess. So within our context, I think I kind of like to level set here, which is that many of us have been doing global health work for a long time, but at this moment, we're all emerging from the worst global health emergency in about 100 years. This pandemic that we've all just gone through, I think, exposed a number of systemic issues with global governance, with who is making decisions and who is benefiting from the decisions, as well as institutional legitimacy and global health equity. It raised a lot of questions. Are we actually all in this together? As I think global health has always been there to do, to promote us all working together for common goals for health for all. And a lot of parts of the world are facing these converging socioeconomic, political, and environmental issues, which many are calling a polycrisis. So it brings us to this moment where we're also seeing that conflated with the growth of anti-global, isolationist, and tribalist political movements. So it sounds bad, but it's actually a call to action. You can go ahead, Jess. Within our health systems, I think around the world, we can agree that not just in the US, but around the world, we're seeing the rise of anti-science movements, mistrust of institutions, and health freedom movements that are sort of trying to sort of create walls and barriers between people and the health practitioners and the institutions that are there to serve them. This is causing a lot of moral distress, especially as we see the systems continuing to propagate inequities. And this is causing, I think, a lot of burnout, not just among clinicians, but among public health professionals. And this has been well documented in the literature. And all this is being compounded by misinformation and disinformation, which is further making it difficult, I think, for us all to carry forth the important work that we want to be doing. So why is it that we're here? Why should we be doing global health, and why is it now? So I really love CFHI. I'm a big fan of Dr. Ebert and the work that the Child Family Health International team and all of their global partners do, because I think we have to take this moment and say we really need to lean into this philosophy that we actually don't have all the solutions, no matter where we come from, and the world can teach us so much at this moment in time. You can go ahead, Jess. Yeah, we have an unprecedented ability to connect with one another, both through social media, through video, through Zoom. There are people from multiple countries that are converging at this moment in time in this interface, and this is really unprecedented. We really learned these skills and honed them during the pandemic, but this is really an amazing time. And we can't solve these wicked problems just by one group of people. It takes everybody. It takes different professions, different areas working together so that we can actually try to come up with novel solutions. So we have this really great moment to think differently, to be creative, and to model these new approaches for the learners that we have the privilege to serve as they embark on their journeys to become health professionals. So from my personal bias, I think that the future of global health means that we need to now put ethics into action. We need to put money where our mouth is. We need to sort of not continue to propagate the old ways that got us into some of these divisive moments in history. We need to move from partnership, where we're just establishing relationship, to allyship, where we're actually working alongside and bringing everybody up to the same level. Go ahead. We need to move from sort of short-term engagement, short-term experiences to long-term engagements. We also need to move from just passively observing things, documenting them, taking them home and saying, wow, I had a great experience, to learning how to turn that into advocacy and action for progress. And then I think pandemics have a habit of turning us into binaries. So it's us versus COVID, it's us versus dengue. We are sharing the earth with pathogens, with animals, with our shared environment. The determinants of health are interconnected, and we have a shared humanity that I think we have to continue to focus on instead of us them binaries. And then finally, we have to move from top down colonial thinking where all knowledge is generated in institutions of higher learning or in the West by European and Western elites, and really democratize power, democratize decision making, and really move things forward in that way. So what does this look like? I think this looks like us doing ethical global health work that is rooted in reciprocal equity-oriented partnerships so we can be true allies. It means preparing our learners for international engagements that use the full spectrum that humanities give us, that philosophy, history, law, cultural studies, these are all things that are important, whether you're in public health, medicine, nursing, or some of the social sciences that are involved in the future of health. I think one of the things that CFHI does really well, and even in my institution where I am now, one of the reasons I just started this work and came here is because there's a lot of focus on identity formation, and that if we want to make advocates and people who are not just going to be passive observers and take experiences home, but apply them for the future for betterment of humanity, we need a better work on reflection and debrief. And this can take the form of narrative, it can take the form of artistic expression, but these are ways that we can start to inculcate some of these approaches amongst the learners that we have the ability to interact with. And then finally, this is sort of the globalization, right? But that lessons that we get from global engagement have a lot of relevance domestically. There are ways that public health systems responded across Africa and Southeast Asia and the Middle East that did really great work, and we can learn so much from if we open ourselves and we humble ourselves. This is what many call the reciprocal innovation. So, so to close, I think I kept it to 10 minutes, Jess. Angela Y. Davis was an activist. Well, she's still living, but she's an activist, a real advocate for racial equity. And I really like this quote because I think this should take us into inspiration, which is that we're not just about propagating the same things in the future and complaining. We want to make change that's for the good. So she says, I'm no longer accepting the things I cannot change. I'm changing the things I cannot accept. So I hope everybody has a great conference. I'll try to stick around as much as I can over this hour. But thank you, Jess, and thanks to CFHI for letting me share this moment with you. And I am. You can go to the last one there. I am so inspired by you because certainly as a global health educator, practitioner, as a clinician, I think this is the moment where we need this kind of global solidarity, and I appreciate CFHI creating this space. So thank you all for engaging with this work.
Thank you so much, Matt. I really appreciate that foundation. And, CFHI has turned 32. We're approaching our 33rd birthday next year. And we were founded by Dr. Evelyn Jones in 1992 when she set up a rotation for Stanford students in Ecuador. And she did so because she felt like the pre-existing models for going abroad during medical school and training were inadequate and inauthentic. When we think about our growth since then, over the subsequent 3 decades, we've expanded our global team to 10 countries, over 25 programs, 15 now approaching 16,000 alumni. We, during the pandemic, pivoted to virtual offerings, and I'll talk a little bit more about that. We have over 150 university partnerships, which we call academic partners, and the competency aims, which we're going to explore, and I want to get feedback on, are numerous, both in our pre-departure training and on-the-ground programming. So really excited to explore the growth and future growth and opportunities. Currently, our global team is spread throughout 10 10 countries. You can see them here. Many countries have multiple locations. They represent multiple contexts, cultures, health systems, approaches, burden of disease, and opportunities to explore a variety of different themes. All of our programs try to provide that 30,000-foot view of global health. And I think this is where the pedagogy becomes really essential, is how do you ensure learners, whether they're undergraduates or postgraduate residents or PhD students or master's students, how do you ensure that everyone is level set, as Matt kind of explained, in that ethical and engagement framework, while also deeper exploring thematic areas of strengths of various locations and communities. So the way we try to do this is ensure that 30,000-foot view, particularly through the pre-departure training and through standardized ethical and narrative approaches, but also drilling down into specific themes based on programs. And you can see some of the themes here. They are a smattering from public health overviews to workforce development, particularly with community health workers and health extenders, rural-urban health systems comparative and infrastructure comparatives, really exploring the integration of traditional healing or local healing practices with biomedical healing approaches and treatments, looking at healthcare access and a human rights framework of health, and how universal health coverage emerges both in a finance mechanism as well as an access and infrastructure mechanisms. Looking at the structural inequities, social determinants of health, and how those intersect with histories and culture and in and out groups and marginalized populations. Looking at specific diseases, particularly those that really represent how health systems are built, such as HIV care, dengue, Chagas. Looking at both inpatient and outpatient settings, as well as social services and those that are non-clinical. Exploring themes like reproductive health and family planning, and that integration. I think, in the US and high-income countries, we often have a rigid differentiation between public health and clinical medicine, and that just isn't the reality in most low and middle income settings. So really bringing to life that merger of public health, population health, and clinical care. But yet at CFHI, even though we're doing a lot of this and we've done it for a long time, we continue to grapple with questions. And I'm going to read some of the questions that we're grappling with, that I'm grappling with, which include the measurement of competency development and impact on learners, thinking about how do we maximize inclusion from a variety of different lenses: program participation, program leadership, local engagement, local trainees. What does it mean to be decolonized? These are words that are thrown around, but do we have shared meaning? How do we walk the talk? What does it mean to be fair trade in this work? And how do we align sending and receiving institutions? And I think this gathering is an example of opportunity to do that. I want to ask you, what are some of the questions that you're grappling with on campus or philosophically as you think about this work or you engage with it? Throw in the comments or in the chat. What are some questions that you're grappling with? They may be logistical, like how do we how do we address places who have a State Department warning? They may be more philosophical, how do we decolonize financial relationships and programs? They may be curricular. How do we integrate reflection? They may be around other aspects of pedagogy. So in the chat, throw some questions that you are having with regard to global health education at your institution or in your professional pursuits. So hopefully we will be able to address some of the questions that come up, and then we'll also have some question and answer session at the end and after each speaker, so we can dive a little deeper and try to have discussion. So I want to turn things over to Robin Young, who is our Executive Director at Child Family Health International. She'll be speaking about our capacity building of our global team, as well as the support of learners and other innovations.
Thank you so much, Jessica. Do you mind running the slides? Thank you. Okay. I only have 3. I'm so excited to be here with all of you. Thanks for joining. It's an honor to collaborate in the many ways that we all collaborate, and I'm excited to see the questions rolling in here as well. So let's see. Jess, are you able to pull up those slides, or is someone? Or I also could share my screen if needed.
Oh, are you not seeing the slides? I'm seeing them on my.
No.
Oh, you're not seeing them. Okay.
Is everyone else?
Yeah, I can.
Others are seeing slides? Okay.
Yes.
Oh, okay. There we go. Sorry. Okay. So we can go ahead. Thank you. So I wanted to just take an opportunity just to highlight some of the areas of focus that we've been focusing on, especially this past year. One of the innovations or new programs that I'm most proud of at CFHI, as we've really grappled with how can we deepen our support of our program participants, our learners, our trainees, while also balancing with all of these fair trade partnership and collaboration considerations that Jessica touched on briefly. So one of the things that we launched in January is our Alumni Advisor Program, and this is under the leadership of Ashley Tran. She's a longtime staff member on our team. She's also a CFHI Ecuador alumni, and she also has other background in global health. She was co-president of a GlobeMed chapter at UCLA, so she has deep commitment to this type of work. So she co-created the program with our entire team, seeking input from the global team, central leadership team, alumni, and other stakeholders. And ultimately, she received dozens of applications for for our alumni who are interested in serving as advisors. And so she, along with a committee, was able to select 19 advisors. And what this has meant is that this year, every CFHI participant, with the exception of a couple of small custom programs that have other additional layers of support built in. So every CFHI participant this year was paired one-to-one with an alumni advisor who specifically recently completed their exact program, so their program location and site. This is a tremendous layer of support that is I think kind of unprecedented, and they receive special training. They do a group Zoom pre-departure meeting. They do weekly check-ins via WhatsApp or email with every single participant on a program. They also offer opportunities for in-country and post-program reflection that have been really powerful. The program was a huge success. Our participants expressed deep appreciation for this added layer of peer support, if you will, sort of peer plus support. And you can see some quotes there. And for next year, we're planning to repeat the program, of course, and expand it by adding dedicated advisors who will focus on student identities, diversity, and inclusion, as well as an advisor who will focus on working with medical trainees specifically. And I should add, advisors are never directly responsible for student safety or questions of wellness. Rather, they're a layer of support. They're trained to escalate to the CFHI team when relevant, and it's really been an amazing addition to our programming. Other ways that we've sought to expand support and safety for our program participants recently, we are in the midst of an equity and inclusion deep dive into all of our core documents, pre-departure training, even looking as far as things like our employee handbook, just really thinking about what we know our values, we know our team norms, how can we refine those? How can we think about the full expression of our values in our work? So when we think about things like equity and inclusion or DEI, these terms are thrown around so easily. Even fair trade is a little bit more in the vernacular in our field now. So, and decolonization has been named. Thinking about what do these terms mean? Do we have shared definitions within our global team is a really important question, because we're all bringing different histories, grappling with what colonialism has meant across the 10 countries where we work, for example, is very complex and nuanced. And then juxtaposing that with needs and expectations of a predominantly US student population is a really important and complex conversation. So we've been undertaking this. We've been seeking expert guidance through a number of consultancies. We've worked with the Ahino Collective. We've worked with Marcia Hinez, formerly of Drexel, who now runs Sassy Consultancy. We've worked with Being Well Abroad, and others as well. So we've been really lucky also to have the foundational expert guidance and input of our global team, of course, as well as our central leadership team in that work. And I think that could be its own webinar itself, and hopefully will be in the future. You will hear from our amazing team member and colleague, Bethany, but in her role, her dedicated health and safety role, which is a role that we created coming out of the pandemic, and that has been a cornerstone of CFHI's work as we have come back into surviving and then thriving post-pandemic. Bethany does one-on-one safety planning calls with students who indicate any extra level of planning or support needed in their health history form or during any aspect of the pre-departure planning and advising stage. So that's been incredibly helpful to make sure that students have the support they need and have gone through the planning process in an intentional way. We've engaged in, for several years now, many all-team professional development workshops and sessions each year. So this year we focused on all-team workshops around facilitating student reflection, understanding mental health realities, supporting student identities, and others. We've dramatically expanded our pre-departure training for all of our participants. So this now includes 3 live orientation sessions, one with our central leadership team focused on safety and well-being, one with our alumni advisors for the relevant program, and one with the in-country leadership so that students can get to know their leadership before they travel. And those 3 are included in nearly every program now. We also have built out a mental health and wellness module required as the part of the pre-departure training. And for faculty-led and custom programs, we also have additional pre-departure materials in those cases. So then lastly, I just wanted to look at sort of the symbiotic and in some ways other side of this coin, deepening our commitment to equity and inclusion in our partnership work, right? And some of the ways that we continue to focus on this in the same way that we're focusing on our trainees and our learners. So Jessica mentioned our fair trade learning and in-depth review and reimagining process. I'll just focus on this for a quick moment. So CFHI has contributed for many years to the fair trade learning conversation. As you all know, fair trade learning is housed by the community-based global learning collaborative. So we've adopted these principles and these rubrics in our work for over a decade now. And through this work, we've evolved partnerships that have strived to have and do have multi-directional benefit and leadership, projects that are locally led, and emphasis on the centrality of ethics and safety during global health engagement. But since 2022, under the leadership of Dr. Jessica Everett and Dr. Juliana Araya Amador, who you'll hear from about practicums later today, we've undertaken a global team initiative to rethink and develop a fair trade learning rubric that is specific to CFHI's programs and also can lend itself, we hope and believe, as a resource to others who are engaged in global health education eventually. So the original fair trade learning domains we're reviewing and redefining within the context of our work include common purpose, host community program leadership, rights of the most vulnerable, theory of change from a community lens, theory of change from a student lens, transparency, and others. So I'm really proud of this work. And while we do intend to publish about this and share our final rubric, I think part of what we found here is that there's tremendous benefit to the work, to these discussions, and this process has in many ways been as much about the journey as it is the destination. We also remain engaged with the steering committee and the global engagement survey through the community-based global learning collaborative. We hold monthly all-team meetings with our global and central leadership teams where we take opportunities to review case studies, share experiences, reflect on our wins and our challenges and opportunities. And then we also seek regular team feedback through, regular one-on-ones, as well as scheduled sort of quarterly and annual one-on-ones with our global team, and through formalized feedback surveys and other mechanisms. So trying to have a multimodal approach to ensuring that we have that holistic view of our collaborations and global partnerships. So thank you.
Thank you, Robin. So I just want to kind of quickly go through a few other initiatives and in a little more depth around some of those that Robin mentioned. When we think about what global health is, we have the Lancet definition, but we have an alternative definition that was put forth at the same meeting that says global health is a concept that is fabricated. When I think about global health programming and educational experiences, we do run the risk of fabricating realities. And so I've been talking to students and to other stakeholders in the field around what shifts are necessary so we're not fabricating someone else's reality. And some of these shifts that I would suggest, and would love to hear your thoughts on other shifts or if these shifts resonate or not. So feel free to put your thoughts in the chat. But shifting from a sense of certainty that we know what should or needs to happen to a sense of curiosity, shifting from a sense that we have to be agents in a short period of time in a place we've never been to being learners and sponges in that location and with community members who are experts of their own environment. Shift from a sense of exceptionalism to humility, from a sense of superiority to really inferiority when we take ourselves to another place. From simplification, both simplified cause, but also simplification of solutions, to understanding complexities and grappling with it and seeking the most complex understanding we can have. Shifting from a deficit orientation of looking what is wrong or what people need to an asset-based orientation where you're looking at what is going well, what are strengths, and similarly shifting from a position of critic to that of admirer. So I think if we're able to help learners and faculty and other stakeholders shift in these ways, we are positioned to be better partners, but also to get an authentic understanding of global health. These shifts also align with the values and principles that have been proposed as essential to global health education. This work is out of Canada, but you see on that outside rung some really key values and principles such as solidarity, reciprocity, responsiveness and accountability, honesty, and humility that underlie all the educational experiences and should underlie kind of the global health pursuits on campus. I think the other thing we often grapple with is like, how do we define the personal and professional development goals? What are our competency aims and how do we measure them? There's a multitude of competency sets. The Consortium of Universities for Global Health, the ASPPH, other bodies have come out with competency sets. Also, we have data from employers that I think is a really helpful guide. So this is a study of USAID contractors who hire folks from high-income countries to work in jobs in low and middle-income countries. And their notion of what's missing when someone has mostly worked domestically or in their country of origin is understanding context and realities of global health. So if we're able to move learners in a way where they understand these contexts and realities, we're helping them be job ready. Similarly, the intra and interpersonal qualities of flexibility, adaptability, and creativity, and we're going to go into more depth on that, as well as cross-cultural skills, sensitivity, and communication, and then knowledge of key systems, players, and processes in global health. So we use this study as really a guidepost for how we develop the competency aims for CFHI programs. And again, one way that we as an organization can standardize this work is by standardizing our pre-departure training. And so we have done a lot of work in the last few years to do this. We have developed the Pillars of Global Health, which can be a standalone course that universities use and is also integrated into all of our programs. And you can see the themes that are explored through that, but also logistical and cross-cultural frameworks for learning, and then preparing students, what to pack, what to eat, what not to eat, how to think about necessary modifications that they have for religious practices, wellness, etc. So when we look at competencies, I just wanted to pull out, because I think specifics are sometimes missing in these conversations, These are some of the competency aims of our Pillars of Global Health, which is one of the mainstays of our pre-departure training. So it includes that contextual understanding, acknowledging histories, transdisciplinary approaches, as Matt mentioned, like really going beyond just clinical or health sciences to humanities and other disciplines. Ethical practice, which is very important, and we use multiple tools for that. Cultural fluency, equity inclusion, planetary health and One Health approaches, health systems building and monitoring and quality assessments, and the global burden of disease and the implementation of solutions towards greater health equity. How do we measure these things? Well, CFHI engages. This is a multi-institutional study called the Global Engagement Survey. This is one tool we use, and you can see the 7 scales and the kind of the measurements that this study is engaging around. This is housed within the Collaborative for Community-Based Learning, and many, there's a whole handful of universities that are using it. So we both can disaggregate our data and then also look at how we compare to other programs in international education. In addition, we are looking at program-specific measurement of competency development. This is a paper we published on our virtual global health elective. You can see the assessment items. There was several areas that were statistically significant in terms of pre and post testing, including their general knowledge of global health, planetary health concepts, competencies with regard to low resource clinical reasoning, and then the aggregate score. We also did a qualitative piece of assessment as part of this paper, which looked at which did thematic coding, increased awareness of global health and health systems, understanding the interactions between biological and social determinants of health, critical thinking and ethical awareness, planetary health, the way that it informs future professional practice, which I know is one of the questions that came up in the chat, and then the concept of cultural humility and respect. We use 2 cross-cultural fluency training frameworks. One is the IES, or Cultural Effectiveness Score. The other is the GlobeSmart tool. These are in partnership with the COSI Group and Aparian Global. I just wanted to focus a little bit more in on the GlobeSmart tool, because if you are doing cross-cultural education on campus, it's really helpful to understand what CFHI is doing so that you can align your curriculum with that your students are getting through CFHI. So this framework looks at 5 domains of culture, and the students are able to plot themselves and then able to compare themselves to 102 different countries. And these are the bell curves in those countries on the domains such as independent versus interdependent, risk versus certainty orientation, task versus relationship orientation. And then they're also taken through case studies. In addition, I want to mention the kind of construct we're using for cross-cultural approaches in general. We used to use the iceberg model of culture. We have evolved to the tree model. I like this one because it connects how cultural differences actually affect our trust and emotionally impact our sense of alignment with others. So we educate students on surface culture, observable patterns that have a low impact on trust, shallow culture, such as personal space, concepts of time that are unspoken rules but have a higher emotional impact on trust, and then deep culture, which is both unconscious and collective, things like how you define kinship, spirituality, relationship between animals and nature, notions of fairness, and how these have intense emotional impacts on trust. So not just talking about culture in abstract ways, but really talking about how it impacts our perception of others and our ability to work well with others. In terms of our thought leadership and research, I just want to mention an example of kind of how we approach this. So currently, there's a problem with 4th-year medical student electives in the US in that medical schools and accreditation bodies are not recognizing the uniqueness of these in terms of the role of the student, the context, and the competency goals and impacts. So we have pulled together a group of over 20 individuals to write a paper and create a toolkit around this. And we also have launched an expanded fourth year medical student elective portfolio. You can see some of the themes here that are explored. So our goal is to both address the sector of global health education at medical schools while also embodying those guidelines and standards in our programs. We're not going to hear from a lot of students today, unfortunately, due to time constraints, but I want to bring to life a student comment and feedback and think about how do we measure impact through this type of qualitative data. So this is from Trevor Hoffman, who is a UK College of Medicine student. He said, I'm a fourth year medical student who participated in the Global Health in Quito, Ecuador program through CFHI. I spent 3 weeks in Quito and 1 week in Otavalo at different clinical sites, including OB/GYN clinics and wards, the OR, the pediatric ED, and primary care clinics. Spent many hours practicing Spanish and building my physical exam skills. I was able to really explore what the Ecuadorian healthcare system is so unique and get an understanding of how it operates. Throughout my month, I participated in many home visits for patients that couldn't make it to clinic, which allowed me to see more of the country and the people of Ecuador. He comments about his host family and how welcoming he felt and how he was able to improve his Spanish, and then goes on to say about how the cultural language and medical education components will have an impact on his practice as a physician. So if we can do this for students and help them orient to those health systems and to ethical learning objectives, we are making great progress in the field of global health education. So I want to turn things over to Dr. Charles Nwobu. He is our medical director in Ghana and is going to speak to us about utilizing evidence-based reflection. Welcome, Charles.
Hi, everyone. Hello. So this session I'm going to go through, I think it will help address some of the questions I have seen in the group. So hopefully that helps. So I'm going to talk about a kind of reflection notes and evidence-based reflection. So could we go to the next slide? Yes. So just to remind ourselves why we encourage and facilitate reflection in our programs. And we can see some evidences here. The first statement says that without reflection, service learning / experiential education all too easily leads to reinforced stereotypes, simplistic solutions to complex problems, and inaccurate generalization from limited data. So it is actually important for us, as we see, for our students to actually have a true and authentic realizations of some of the reasons. And this is why we actually facilitate some of these reflections so that there can be clarification, engagement, and deep thoughts for them to actually explore the cultural context and understand the reasons and some of the presentations that we see. So this is also another statement here. I won't read it, but it's just one of the bases of why we actually encourage and facilitate reflection. So the evidence-based reflection, what is unique about this kind of reflection that I actually learned, over the past years, and I actually use on our students, is the use of evidence. These are some of the characteristics. I usually use it to students, even the practicums, some of them undergraduates to when they come for experiences in Ghana. So one of the most important characteristics, which is number one, is the use of evidence when actually reflecting. And this evidence could be peer-reviewed articles, academic literature, recognized publics, where they actually reinforce what they see by actually going to read about it. We know in our experiential learning, students sometimes can have a whole lot of experiences even in a day. They may see a case, they may ask questions, they may be answered, but they may need to actually fully indulge and actually explore these themes more. And there is also the need to actually confirm some of their findings, by reading more about it. So even when you use this evidence as a reflection, it helps to do that. Another important tool is andragogy, which we also know as adult education, where we also want to teach our students to actually take responsibility of their learning, and that is also one of the characteristics of postgraduate education. But we want to introduce it early. If it's in Ghana, we use the term, we don't do spoon feeding. When we're medical schools, the first thing they warn us is that, listen, the medical school is is not for spoon feeding. Medical school is what we call student-centered learning. So don't expect us to tell you everything. We will give you, the basics, and you are supposed to go and build it. And when you share, we'll correct and guide you when you present what you have read and learned. So that is one of the things we do in these reflections, because we know that even with a whole bunch of experiences, sometimes these experiences can be confusing, and it is important for the student to reflect and sometimes take responsibility in finding the answers, you understand, of the situations they find in their global health experience. So one of these, we teach them how to state. Whatever you see, you have to cite where you're ready to define, you explain, you cite the evidence. When you reinforce your discussions, you cite, when you explore thematic frameworks, you cite where you got. And when you even develop plans for development, you should be, looking for some kind of evidence to direct you. We also emphasize, just as Jess covered, the importance of humility and respect, because sometimes doing this reflection, we don't actually blame students for doing this, considering that sometimes these situations are the cultural shock. But sometimes you see students becoming more like critics. You see sometimes the power dynamics coming in when they reflect. So we actually teach the most important of understanding humility and respect. It's not about we versus them, or they are not doing it right, or we are better, or they are old school. It's more like understanding the factors at play to understand why things are done differently and why things are differently. You understand? Exploring culture. Also, one of the reasons, important aspects also, is that we ensure that they are reflecting towards self-development and or professional development. So we ensure that they have an action plan. Okay, what have you learned through this experience? How are you going to apply? Okay, you saw something. How are you going to build up yourself from what you have learned? You should have smart objectives even after your, experience in global health and programming a day. And I'm going to give some examples. So one of the important things again is that we also teach them helpful phrases to use when reflecting, and these are just some of the examples we have. You can say, I am glad, I think, this was because, next time I shall, I need to, I am planning to, henceforth I shall. So these are some helpful reflects I also share. I have a longer version of this presentation I use for some students, especially my PhDs. I have had some doctors of public health and senior people that actually come for practicum, and sometimes they're expected to write reflection, and I encourage them to use evidence-based reflections so that they can appreciate and have a very comprehensive report to present. And sometimes they are confused on what tense to use, and this is very, very helpful for them. Yes, next slide. So we have various reflexive frameworks, and we know a bit, but I just showed examples. I have two examples, a very short one. This is a very short form by Driscoll, 1994, who presented this on what, so what next. Some of us might actually know this, but the most important thing is that, how you use this in evidences. So when they recall an event and they have to cite, they present this, they have to write descriptively what happened, then whatever it is, you have to cite and explain what you're seeing. For example, a student sees a case of an unconscious child with cerebral malaria. They state what they saw that day. They now have the responsibility. They may not even have the opportunity to have the full definition or characteristics. They might hear it, but they go back and they now go and read about it and cite. They can define cerebral malaria based on evidence. They can enumerate the characteristics. From them, they can, even during the lecture, they might hear, oh, it is not very common, but it is now their responsibility to know what is the numbers. Is it a 10% presentation of every complication? They go back and they read and they write and they cite it. How is it distributed? What is the statistics globally? What is the statistics in Ghana? They take responsibility of this situation to build their knowledge on this kind of examination. So what? Okay, they whatever emotion they're expressing, they might ask, okay, they were sad, they saw an unconscious side. Okay, but what was also positive? Okay, they were glad that there was a team that was seriously managing the patient, you understand, with all the necessary medication and support. Okay, what was sad again? Okay, the parents could not afford. What was positive? Okay, the hospital was able to get some funds to support, even though they were not. So these are things, and they can also cite evidences of this. Okay, how strained they health care is, because of a lot of health workers. Okay, the issue of the socioeconomic factors that affects, why patients cannot actually pay for the medications and for the children. So when they see, they kind of read about these things and they're now able to answer the questions, because sometimes they may not be able to have this engagement fully. Even, they may share and discuss some of these things. So sometimes the focus may just be on the clinical presentation and the treatment on the ward round. But by the time they come back and they do a write-up, even sometimes they might have the weekly sessions as we do with a healthcare worker who comes to educate, but they still have to take the responsibility to now read about these things and cite some of these evidences. Now, what's next? They get the opportunity to also conclude about some of these situations and, kind of make a trajectory on how they can do. Now, there is a helpful one, the next slide, yes, which I actually use for the students, which is the Gibbs one, which has about 6 themes. Why I love this is that because it's very well guided, that even for every team, they have a whole bunch of questions that students have the choice to use them to give them the sign of direction. So this is one of the frameworks I use for actually the starter students who have never been engaged in reflection, and especially students that want to have a detailed reflection. So the same thing that undergoes in these stages, the importance of citing these evidences, the importance of actually exploring articles to ensure that they actually make sense of this experience, so that they ensure that they're not judgmental or just making opinions, and also making sure that they are balanced, finding balanced arguments, you understand, so that they're actually objectives, because sometimes even some reasons can be argued. So you argue the points and, come with a reasonable consensus that your leg judgment, understanding the social determinants of play, and also the importance of having an action plan. Okay, after this experience, how can I gain from it? What should I do? For example, I will just use the example of malaria. You've learned about cerebral malaria. Okay, the next week, I should be able to read about other complications of malaria. So you take responsibility. You saw these complications. There are so many other complications. You may not get the opportunity to see all the complications, but within the next week, you're now going to take responsibility to read about it so that you gain the knowledge. Even as educators, sometimes you understand you can learn some things and you take responsibility of also improving. Maybe you want to also share this knowledge with your other peers in the next meeting, that this is what you learned, the next critical meeting or the next online virtual minute. You take that responsibility so that you hold yourself accountable when it comes to your development. So this is one of the reflective cycles I use. I think the next slide. I think this is now come to the discussions and questions. I don't know if we can, give examples of reflecting in action. We want to know what is difficult about integrating reflection into programs, and how do we measure students' progress using reflections, and any kind of questions that anybody have, we should feel free to actually answer. But just as I said, for someone's question, this is one of the ways you can actually engage undergraduates. You need to provide, for example, the Gibbs. There's a lot of questions. You guide them, you give them the framework, you teach them how to start, searching for articles and reinforce it, so that by the time they finish, they don't just come as people coming for programs and you're wondering what they learned. They take back in this active reflection, not just using opinions, but actually using evidence to reinforce some of the engagement that they have. Thank you very much. So please feel free to share the questions on the chat zone.
Yeah, thank you. So in the chat, feel free to dialogue with Dr. Nwobu and others around how you're working with reflection and challenges and opportunities, successes that you have. Thank you so much. I just want to point out that CFHI does co-sponsor the CUGH's Reflection in Global Health contest each year, and it's currently accepting applications. We also published the Reflection in Global Health Anthology, 2nd volume this past year, and we'll post, Madeline will be posting those links in the chat, and they are open access, or you can purchase the hard copies or electronic copies if you'd like. I wanted to introduce Carolina Bolaños, who is our Director of Programs, to speak to faculty-led and custom programs. Welcome, Carolina.
Thank you so much, Jess. And it's so nice to be here. I'm very excited to share a little bit about our work with custom programs because these programs offer institutions or academic partners a unique opportunity to align experiential learning curriculum directly with their specific academic goals that they might have, right? So it allows us what I call like a common thread to have these global health competencies that are present in all CFHI programs that we want students to develop: cultural humility, intercultural communication skills, system thinking, planetary health, ethical engagement. Those broad overarching competencies work as a common thread to tailor those in a way that is applicable to each field of study. So there's many ways how we can customize a program, and that we work with academic partners to reach that sweet spot where we meet all the requirements and also align with the expectations, right? So we customize duration. We have from 1 week all the way to 8 weeks, or even more if depending on each discipline. Today we're going to hear a case of a physical therapy custom program developed in La Paz, Bolivia, but we also have tailored for nursing students, for nutrition, medical Spanish, and so on. So that's an area where we can definitely work together with the faculty to tailor, and also the focus area, if it's specific to maternal health, to migration, and that we achieve by modifying or customizing what is the student experience in terms of like the clinical rotations, the public health activities, or how we want students to engage in this activity, which speakers bring in for the lectures or other activities that might be part of the program, and even the extracurricular activities. So there's a whole range of things that customize in a way that we get at the end a program that aligns both with the experiential learning competencies that we want in global health, but also the curriculum that the faculty might have back in campus. And this, even though it sounds very simple, right, it's a collaborative process. We can still go to the previous slide, that's like, that is not a linear process at all. It sounds very quick, but it's a very dynamic, interactive process that we have to go back and forth with sometimes the university to really understand the learning outcomes, especially when faculty arrive with a set of activities that they would like to see in a program, and not necessarily the learning outcomes that they want to see in the program. So we really need to go back and understand what we want students to get out of the experience, and then align that with local resources, local strengths, the local team's expertise, and their partner network as well. And I just want to also highlight how faculty-led programs have been changing a lot throughout the years. We used to think or have this idea that X amount of students, one faculty abroad, and they're leading part of the teaching or mostly of the teaching. We have seen models that have been shifting a lot to adapt to current realities. Academic partners that might have their faculty back home, having weekly check-ins with the students, and really leading the academic curriculum altogether, or reflection sessions, but having students in country with a local team. So there's many ways how we can get creative in terms of adapting resources and the local realities that we have in that moment. So we can go to the next slide. As Jessica already mentioned, students go through a really robust pre-departure training to engage in any CFHI experience. When it comes to custom programs, they usually added elements in terms of custom pre-departure training or custom pre-departure orientations that we have with them. But we also at CFHI want to recognize the role that faculty has, and created this module that is designed to support faculty in their experience. We talk a lot about students, but we also need to align some of the expectations and role and responsibilities with the faculty. This is particularly helpful for faculty that might be the first time they're traveling abroad with a group, or the first time traveling abroad with a group with CFHI, right? So this way we're somehow pulling or incorporating the faculty to the CFHI ecosystem of ethical engagement, and that comes up and is transversal to our health and safety infrastructure. So today we're going to hear about a very specific example of a physical therapy program that was developed in La Paz, Bolivia. And this was developed with Gonzalo Clara, a local coordinator, and also Dr. Cecilia Uribe, that is a medical director in La Paz. And we partnered with Acadia University, specifically with Dr. Jessica Denson, Director of Student Experiential Learning for the Department of Physical Therapy. So today we're going to hear from Gonzalo and Dr. Jessica about the experience.
Thanks for the introduction, Carol. Hello, everyone. So nice to meet you. And thank you for the opportunity to be in community with you today. As Carol mentioned, my name is Jessica. I'm representing Arcadia University, which is in a Philadelphia suburb in Pennsylvania. And kind of like how Jessica started the presentation today, I'm here to talk about the big picture why that this custom program came from. So Arcadia University's mission is a global, integrative, and personal learning experience. And then under the umbrella of Arcadia University, our College of Health Sciences, which is the college that the physical therapy department lives under, speaks to justice, interconnectedness, and facilitating both leadership and change makers in our students. So it's from that foundation that there was a really nice alignment with the foundation that CFHI brings to their engagements. So it was from those mutual whys that we put together our program goals of exploring the PT profession within the Bolivian healthcare system so that the students might gain insight to cultural and professional practices in a global context. So the way that that looks is a practical experience that complements classroom theory. Arcadia University is a member of the Consortium of Universities for Global Health. Our College of Health Sciences is also a signatory of the Brochet Declaration. So those are the foundations from which we inform our classroom theory, which also complements CFHI really nicely. And what that's resulted in is a custom program that Gonzalo will speak to more specifically, but some of the custom highlights include a 2-week engagement as opposed to a 4-week, which helps balance the rigors of an accelerated doctoral program that our students are working through simultaneously. It also includes more opportunity for reflection. Reflection has come up frequently in the discussion so far this afternoon, and I really appreciate the collaboration of the team to build in even more opportunity for that thoughtful discussion. And ultimately, as Caro mentioned, it's a really wonderful collaboration where we have regular communication and kind of continuous refinement based off of all of the different stakeholder feedback, meaning students, partners, in-country directors, faculty, and so on. So from that big picture, I believe Gonzalo is going to speak more to the program highlights specifically.
Thank you. Thank you for the introduction. Jess and Carol, thank you very much. Well, we've been talking a lot about new things at CFHI, but something that we keep, and it's been traditional and something that we are really careful planning is homestays. That's a very big part and very important part of our experience, because we believe that this, exposing students to authentic cultural exposures, language practice, cultural insights, all those aspects are enhanced and fostered by the homestay experience. We are very careful when it comes to selecting the right families, because we want a family that is going to give them cultural insights, is going to give them a lot of their own opinions. Students are going to integrate what they see in class with what families are mentioning during meals and during interactions with the students and everything. So it is a great way to interact and to integrate students into the community. Next slide, please. Together with that, we consider that homestays give us the possibility of giving authentic knowledge. They're also, as part of the program, as part of the design, students also talk with a lot of local experts. They have a chance to hear from physical therapy experts, and we're not talking about just the clinical setting, but the formal classroom setting where they have conferences with doctors, with practitioners, with anthropologists, where they learn more, where they the idea in general is to make sense of the entire context where the program is taking place. So as long as in the mornings they are exposed to clinical experiences, in the afternoons they have reflection, they have language speaking classes, they have the conferences with practitioners, they have conversations with the local staff, they have conversations with each other. They have a lot of interaction. Together with that, complementing everything, we have cultural experiences that we also like, because that is also part of it. You know, they go and visit the city, they go and visit places. So since they are staying here for 2 weeks, they also have the opportunity to see museums. They have the opportunity to see not only the museums, but also important things, important aspects of what the museums are offering. And also on weekends, they go to Lake Titicaca, where they have also the chance to explore what the local culture is all about and where Bolivia and a lot of actually the New World is coming for. So it's coming from, sorry. So that is a lot of community engagement. It is practical application of learning. There is a lot going on during the program. The next slide, please. So besides that, all this program comes together through joint planning. I like to think about this as and 3 stages, because first the university contacts CFHI, then they start planning together, and then they get in touch with us locally, and then we start planning with everyone until we come up with a product that will give us, you know, something that is satisfying both to the university and to the local team. We do something we can do. We offer something we can do. We deliver what we have offered to deliver. Now, within that, we plan everything every day to the minute. So they have everything, a very complete set of activities, plans, and everything. So something we have built into the program is a space for reflection. What I mentioned before, there is a space for language training that depends on the number of hours that the university requires. Then we have the morning clinical rotations. We have the clinical, the cultural experiences, usually on weekends towards the end of the week. It is a relaxing activity. We hire people that take students to local sites and they visit museums and places that are interesting. And then, of course, we have the presentations and that are both cultural and clinical, where they talk to a lot of people. I've seen a lot of questions. I've been present, you know, during all the activities except the clinical, but I've seen a lot of students, you know, really truly engaged, asking questions, wanting to know more. I think that enriches the students' practice and experience in La Paz very much. So thank you very much. That's about it. Thank you.
Thank you. If there's any questions or comments for Gonzalo or Jessica or Catalina, please put them in the chat function. Would love to dialogue about this. I want to welcome Dr. Juliana Araya Amador. She is our practicum coordinator and a physician in Costa Rica, and is going to speak to our practicums and processes along with Dr. Nuobu. Welcome.
Thank you so much, Jess. Thank you so much, everyone, for being here today. It is an honor to be able to speak to you about our practicums. And if you could please change the slide. So what exactly are CFHI practicums? CFHI practicums are structured, supervised, and evaluated professional experience that will allow students, which are often masters and professional level trainees, to develop competencies and practical skills in a real-world setting while they are completing their capstone or applied practice experience. And if we can go on to the next one, thank you so much. So CFHI practicums are available in different formats: virtual, place-based, or hybrid. And whichever the format, they have a duration of 4 to 12 weeks. This is something that ensures that students have enough time to immerse themselves in the local context, and it allows students to understand the complex health, social, and cultural factors that are often in place, while also developing meaningful relationships with the community members and other professionals. So whether it is online or on-site, this time frame allows for students to be able to contribute and develop higher quality products that have a more profound impact on their learning experience and to the work that is being done locally. And this brings me to the product design or the project design. And this is something that goes very closely with what we have been mentioning about CFHI and the asset-based approach. So determining the practicum project is going to begin with a virtual meeting between the practicum coordinator and the person that is interested to determine what site might be the best fit. Once the site is selected, the local team will be developing a more detailed practicum outline that focuses and uses an asset-based approach. This identifies and builds on strengths and resources of the community and local healthcare systems, ensuring that the practicum is not only enhancing the trainees' learning experience, but also supporting and contributing ongoing local efforts. By aligning the practicum with existing initiatives, the program fosters sustainability and also reinforces CFHI goals to maintain sustainability and reinforce the local partners' ongoing goals. So we can see here, it is created with academic requirements in mind, student interests in mind, and of course, and most importantly, those online going efforts. So we can see here the project areas will fall under one of these, and these are some possible deliverables. So we might have a project that falls under one of these umbrellas or several of these umbrellas: the no-do gap, a literature review, a reciprocal innovation analysis, and we have deliverables such as grant proposals, policy briefs, informative videos, educational material, a public health poster, or others. And again, this is determined for each student in collaboration and really led by the local team and the local efforts. And something that is important is that preceptors are going to play a fundamental role in mentoring their trainees throughout the practicum, whichever modality it will be. They will work very closely to develop those objectives and determine what those key deliverables will be. And we have the opportunity today to hear more about this process from one of our preceptors, Dr. Charles. So Dr. Charles, can you please tell us a little bit more about what this looks like on your end and how these practicum projects are developed and what comes into question when you are developing these?
Yes, thank you, Juliana. So just as we see on the slide, I usually get a notice from Juliana about the interests from a student. I mean, what is very important is looking at the CV and the letter to see how I can align students' interests, with the organization's goal, but also to ensure that the students are also developing the competencies that are needed, in the course that, usually we have this MPH and MGH competencies when students are actually doing practicum that the university expects. And we want to ensure that at least what they are doing are meeting, about 3 or 4 of these competencies or even more. We want to ensure that by the time the student finishes, the student feels and knows that they are different, that they've learned something they can actually apply in society. So that is why we go through these stages. Then we now create this outline, share with the students. Student gets the opportunity to see the outline. Then we have a meeting. If there are any adjustments from the feedback of the student and also from the institution, sometimes they may want more, like multiple deliverables. They may suggest something. Sometimes they also put the student to tasks to actually create something so that they're actually ready to, and more engaged in the practical before they start. So by the time we do that, they'll also finalize the practical outline. There may be some signatures and administrative procedures. Then when we are ready, everything is set, we now start the practicum. So next slide. Now, and these are some of the skills that are required, and sometimes students may not have it, but they may get the opportunity to actually acquire it in the process. So these same and recognized skills, very, very important. Sometimes this is the first time students they expect to be told everything, but we see them pushing them, go and read. Okay, I don't know how to use this, Google it. Okay, I don't know how to use a citation manager, go and watch a YouTube about it. You understand? So they start learning how to actually take responsibility. And that is one of the important things. So most of the synchronous direct hours are not even as much. A lot more is the asynchronous hours, the time they actually take their time to do a lot of things that are on, download these articles, synthesize these articles, draft these articles, learn how to use some of these apps and things to actually improve their work. One of the most important things, especially in practicums, is for them to be able to know how to use evidence. Evidence is one of the main pillars of public and global health. So searching literature from use of credible databases, knowing how to use search terms and strategies to get what they want to actually apply. A lot of things we do in public health are not think tank and based on evidence, frameworks, themes, that you need to know something that is relevant and recommended and accepted. So having this training is very, very important. Of course, citation skills, we teach them and we recommend the university actually prepare them, because by the time they come to practicum, some do not have, but by the time they finish, they're able to learn and apply some of these things. Also, academic writing skills and professional writing skills. Some people write as they speak, and we find out that we have to teach them that so that they learn how to write in a scholarly and academic way. I mean, we also provide them the directions to things that can help them, like Grammarly, where they even learn how to use some of these things to help them edit and make sure that they are actually having the right tone for the academic direction they want to find themselves. And of course, our reflective writing, how they are able to actually, reflect appropriately in a non-judgmental manner, using evidence, considering culture and context and towards their self-development. Also synthesizing evidence using framework and relating practice, a lot of things to do to reality and practice. A lot of the practicums, sometimes 4 weeks, 2 to 4 hours with the practicum. Most of them, they do not do direct research per se, but we make sure that they know how to actually use a lot of the research work that has been published, make sense out of it. It's more of implementation science. Next slide. Next slide. Now, I just use this opportunity to give example of some of just, I have one here by a student from Baylor University where, she was, trying to advocate for the use of HPV vaccination in Ghana. I mean, this is a barrier we have. We have not nationally approved the use of HPV. We do have HPV, but it's more like vaccine, but it's more like privately used, you understand, but like other countries that roll out nationally. So this is something that we'll be advocating for. So we teach them how to use evidence, where they use things like efficacy. They go and research about randomized controlled trials, share the information. They know about the safety of some of this intervention, look at cost effectiveness studies, summarize all the cost effectiveness studies, acceptability. These are some of the themes, you understand. Then they are able to now use this to argue for a point and present and make evidence-based recommendation and direction. So this is an example of one of the practicums. The next one, so I think the HPV is more about infections. The next slide. And that one is, this is a very good one. And we have a variety of students. The first student was just a student that has a BSc and that was in a postgraduate. This student was actually a well-seasoned, retired pediatrician who was a FAME fellow from the American Academy of Pediatrics. So we get extremes from young people to elderly people who are even involved in our practicum. And her practicum, she was able to, write a project, a grant proposal that was mostly centered in one of our partner sites on malnutrition. And this was some of the themes she had to cover during the, we teach them how to address some of this, and they're able to create a very, very convincing project and grant proposals. So this is something that has to do with malnutrition. We talked about HB, which is more like women's health and infection. Then the last example I will give, yes, this is an example, because sometimes some students are very, very creative. By the time we look at their CV, we see that some of them might have history of working in design or somewhere very integrative. Now, this is something that is actually being used in Ghana. We use this to create for one of our projects in Ghana. A student actually created pamphlets. And if you look at the pamphlets, you can see that they are well evidence-based, well cited, where they are talking about disabilities. And this is what we roll in schools, you understand, and we use on one of our projects. So we supervise them, we guide them towards actually making evidence-based information materials, and they also put their talents in design. So we actually have a whole mirage of, where we can actually apply people. And we kind of see some of these things. Just a little portion of your CV showing your experience and interest in design can actually give a sense of direction. So these are good examples just of practicums. So thank you very much. CFHI is definitely an unique opportunity, and we always recommend, this is a way to engage your student effectively in our programs.
Thank you very much, Dr. Charles, for that. Yeah, Dr. Charles is one of our preceptors. We have opportunities for practicums in 8 of our sites, and I would like to leave the space open for any questions that we are happy to address. Thank you so much.
Thank you so much. Please engage in the chat. Maybe Juliana, you can put the link to Practicum's website in there. And certainly we're all grappling with how to develop projects abroad that honor local leadership and knowledge. So really appreciate this work. Bethany is going to take us home with the foundations of health and safety. Welcome, Bethany.
Thanks, Jess. I will just spend a few minutes. I want to allow some time for Q&A at the end. But I'll start off talking a little bit about our approach to our pre-departure training, which, as Robin mentioned earlier, we've really taken an intentional approach to, and try to focus as much as possible on resilience. And we've found that that helps to really prepare students for the realities that they're going to face once they arrive to an on-site program. We don't always know what realities people are bringing with them or what their previous experience is that they're going to bring with them to their program. So why this is important, of course, we all know the prevalence of mental illness continues to increase among college-age students. But culture shock can affect any student regardless of their pre-existing conditions, and it also helps to prepare any student to support somebody else up here on their program who might end up struggling with the realities that they face locally. It's also important to recognize that working in a global health context, working in a clinical setting, can present students with a traumatic situation that they may not have encountered before. Experiencing pain and suffering, witnessing that perhaps for the first time can be daunting, as well as confronting the realities of engaging ethically in global health and separating themselves, reckoning with the complexities of global health and with their role as a learner versus a change agent. We can go ahead to the next slide. So really another foundational approach to our pre-departure training is trying to create shared values, shared understanding, as well as normalizing a lot of these conversations, talking early and often about mental health, about the realities that they're going to face on their programs. So for that reason, we focus quite a lot on CFHI's ethical framework that's discussed throughout the pre-departure process. And as was highlighted earlier, there are several asynchronous modules that students complete throughout the pre-departure process, which focus very closely on the ethical framework. But we also have some modules on mental health and self-care, as was mentioned before. There's an image here to the right of just one of the tools that we try to provide to students before they get to their program to help to deal with anxiety should they experience that, for example. We're also actively developing a module on identity and safety, so talking more specifically about certain marginalized groups and how they might, questions they might ask themselves, how they can prepare to navigate once they arrive on the ground more effectively. We also really encourage students to recognize their own role in their health and safety. It's a shared responsibility. Of course, CFHI will do everything we can to prepare them and support them both before and during their program, but we also try to give our learners their agency in that process as well and encourage them to recognize that they're an integral part of the health and safety journey. I think this was mentioned before as well, but I also review every participant's health history form, which is required of them before they leave for their program. Look at any needs for perhaps ongoing care and support. I partner very closely with Dr. Everett on that process as well, and we'll set up individualized calls with students as needed in order to ensure that we work with them to create a plan together. I think we can go to the next slide. Thank you. So moving now to the on-site experience for students, I want to touch very briefly on the support structure that's available for them. Of course, we rely very heavily on our global staff as the experts in their own environment, and they are the on-the-ground support for students at any time. So that will include our amazing local coordinators, any other support staff that are available locally, and our on-site medical director. Of course, we have a 24/7 emergency line, which goes straight through to our central leadership team at any time should they need to reach out to us. And I am available to students, of course, at any time as well. So high level, when an incident occurs involving a student, this could include something which is really the most common thing is a gastrointestinal basic health issue. But this could be anything from that to a mental illness to a natural disaster. The local team, again, are the on-the-ground immediate support. So they're going to assess the situation, immediately provide the assistance as necessary, which might include making sure that that participant can get to a healthcare facility, which we have previously identified as a trusted provider, accompanying that student, and always keeping an eye on that participant's emotional well-being and the well-being of the group as a whole. They'll then contact me as soon as possible after those immediate actions have been taken care of. I'll reach out to the student as well, make sure that I'm checking in, relay any guidance to the local team on how to continue the support with that student. And I'll provide insurance information to the participant as well to make sure that they can get reimbursed for any medical costs that they may have incurred. And then, of course, we're going to continue to follow up with the student as needed and the group as needed. That's going to vary based on the nature of the incident. So some considerations to keep in mind that are very CFHI specific and specific to working in a global health context. Of course, we have our medical directors at every program across the 10 countries that we work in. Those medical directors, while they are licensed medical professionals locally, are not going to be providing care directly to our participants, but they are uniquely positioned to develop close ties with the care providers, the healthcare providers that we trust locally to send our participants to. So they have developed really strong relationships with those trusted care facilities. And our global medical director, Jess Everett, can help us to provide context as well if we're dealing with a more complex physical health incident. So some things that are specific to our participants working in clinical settings, our medical directors are very intentional about ensuring that our preceptors are informed of our participants' skill levels, and that our participants are informed about the limitations of practice in clinical settings. This is covered very many times throughout the pre-departure and on-site process, but helps to ensure that students don't find themselves in a position that is difficult or uncomfortable where they have to decline to participate in an invasive procedure, for example. And we always inform our participants about standard precautions, protective gear, and course of action for any kind of exposure. And we're very intentional, again, about avoiding placement in places that are high risk for diseases such as COVID-19, TB, and bloodborne pathogens. All of our participants are enrolled in an insurance plan. This covers them for any emerging accidents, illness, evacuations if needed. Most routine care is going to be out of pocket, so that's why I follow up with students regularly to ensure that they know what the reimbursement process looks like. I think we can skip this one. We've covered custom programs as well. And yeah, our whole framework is really built on the ethical framework ultimately, and this applies as well to health and safety. I'll stop there and leave time for questions.
Thanks, Bethany. Yeah, just to kind of emphasize the foundations that we're built on, it really spans everything from marketing and outreach to pre-departure training, preparations for health and safety, setting trainees up for successful and fulfilling and professional and personal development opportunity. I wanted to we have a couple minutes. If you have any questions or comments, here are some of the topics that we covered. Would love to hear, and wanted to invite any of the CFHI global team members to make any additional comments or thoughts while we have a moment. Well, we look forward to engaging. Here's more of the ways to find us on social, email, web, etc. And thank you again for your time today. We look forward to collaborating further. Take care.